what we're seeing in the youngest children, so these are the kiddos that are less than 5, so between 0 and 4 years of age. Last week we hit a new outbreak record for the number of cases reported among that particular age group. So that was a grim milestone, but so there's that. But we're also seeing increases across all age groups. I will tell you that the level of increase is higher in younger kids than it is in, sort of young adults, and older adults. So, and keep in mind that anybody who's between 0 and 12, it cannot be protected with the vaccine. So we are seeing very concerning trends.
What is most concerning is tracking the number of positives primary health had per week. July 7th, if you look at from 5 to 18, we had, I think it was 6 positives for the whole week. We're, in a sense, I accumulated on a weekly basis, so in a sense, I'm a week behind. And last week we had 123. So if you do that math, that you can't get more frightening than that. Because if you multiply 4 or 5 to get 123, you do that math now the next 4 weeks. Now we're really into a scary territory. So I think the media has heard me on this subject, and frankly, I don't think I can say it enough. I'm extremely concerned about the children. Unfortunately, we have seen Texas, Florida, Arkansas, Louisiana. 4 weeks ago in Louisiana, a very well-known children's hospital, Ochsner, in Louisiana, had 0 children in the hospital. They're now averaging 5 children a week in the hospital. Texas, 2.5 weeks ago, they had no pediatric intensive care beds. Florida, about 10 to 12 days ago, had 247 children in the hospital. And from my perspective, any child that's admitted to the hospital, and certainly any death, is preventable. And what we haven't talked about, and I wouldn't get off this conversation if I couldn't bring it up, which is, of course, I support vaccinations, but we can stop this in its tracks right today, right now, if I wear a mask and you wear a mask, if everyone wears masks in all instances, and particularly in schools and inside. There's just no other way to put it. At the point that Dr. Turner starts telling us statistics about children being hospitalized, we're behind. We're behind. So I hope the media, I hope you make this very clear in your report. Now is the time for parents and their children to wear masks.